According to the CDC, 71 million Americans have high LDL cholesterol, the cholesterol that tends to form blockages in your body's blood vessels, the killer cholesterol. Now this means 1 out of every 3 Americans is at a high risk for getting heart disease, which also conveniently happens to be the #1 cause of death in the entire world. Now unfortunately, less than half of these Americans try to do anything about this problem, but when they try to consult a doctor about it, they often get statins as a priority option. Now through my research and personal experience, I want to tell you the dangers and benefits of statins, as well as the dangers and benefits of natural cholesterol control methods, and let you decide for yourself which one is best. Statins are often a godsend, but what they really are is a wolf in a sheep's skin, waiting for the right time to do more harm than they do good. Today we'll discuss 3 things: the overprescription of statins in the US, the dangers and benefits of statins, and why natural control methods can be just as effective and 100% safe. Now, any foreign object introduced into your body has the ability to cause harm, and statins are no exception. The ease with which statins are prescribed to America's patients today is quite terrifying. The Medical Expenditure Panel Survey's records show some shocking facts. America spends $20 billion every year on prescription of statins, and receives 3 times as much in revenue from the patients and the insurance companies. Also, between 2000 and 2010, the number of patients prescribed to statins increased by 179%. And I used the US Census Bureau's population records to calculate that the increase in population over that decade is roughly equal to the increase of patients on statins, which shows that there's a problem in how many statins are being handed out to patients. Now, why do doctors like to hand out statins so much? First of all, they're expensive and a good source of revenue for the doctors. Second of all, they're a quick fix. They start working quickly and seem to be a cure all of a sudden for many cholesterol patients. And 3, it's a popularity deal. Once one person sees someone else whose cholesterol drops so rapidly because of these drugs, they decide to try them too and take care of their problems. Now, Reuters news agency recently did a study of over 2,000 cardiologists, and over 70% agreed that they would prescribe statins even if the patients were at a low risk for getting heart disease. This shows that not only are they prescribed too much, but often without any reason. Now, statins aren't completely useless. There are times when they are absolutely necessary, but you have to understand the dangers and benefits of statins in order to understand whether they would do you more good or more harm. Now, the benefits of statins, first of all, is the speed at which they act. They start dropping your cholesterol within a few hours of you taking the drug. Second is their life-saving capabilities. If you have a patient who has a stroke or a heart attack, dropping their cholesterol immediately is crucial for them surviving the incident. Now, Mayo Clinic has outlined the 6 major side effects of statins as well. First of all, it's a continuous use problem. Once you get on a statin and you stop, your cholesterol often rebounds higher than it was originally, which means that statin patients are trapped and have to stay on statins for their entire lives. The second side effect is muscle deterioration. This is one of the most common ones, and muscle deterioration occurs for statin patients, and the problem is they also lead to further complications such as kidney and liver failures. The third one is liver disease. Statins make the body prescribe or create more enzymes in the liver that are being created, and this means that it causes liver damage or liver failure. Now, the fourth most common symptom is digestive problems. Anyone who takes a statin gets gas, diarrhea, constipation, bloating, nausea, all these types of problems. The fifth symptom is neurological problems. Now, interestingly enough, these reverse once you stop taking statins, but while you're taking the drug, people often have memory loss and confusion. And the sixth and really funny symptom of statins is high blood pressure and type 2 diabetes. Now, ironically, the drug that lowers your cholesterol leads to hypertension and type 2 diabetes. Now, why did these symptoms occur? No one actually knows. So you see, even with this high level of uncertainty, doctors are still prescribing statins to patients because of their ease, cost, and efficiency, but do so without considering the long-term health of the patient. Now we can take a look at the natural cholesterol control methods, and you'll see that they're 100% safe, yet just as effective. Now, even when you take statins, doctors say maintaining a healthy lifestyle is key to being healthy. You can't just take statins and get rid of your cholesterol. Harvard's health department did a study and discovered that soluble fiber can actually help you lower cholesterol because it takes it out of your bloodstream. Now, foods that have soluble fiber in Harvard's study include nuts, grains, oats, barley, and fatty fish such as salmon. WebMD also did a study where they discussed the uses of natural control methods and compared them to the effectiveness of drugs. If you lower your body weight by 5%, it cuts your LDL levels by 15%. If you eat a heart-healthy diet, it cuts your cholesterol levels by 10%. And if you exercise moderately daily, moderately meaning that you can breathe enough to talk but not to sing, you lower your cholesterol levels 20 to 30%. Now if you look at this chart I made, these are the 6 statins most widely used as according to the FDA. And these are WebMD's studies showing how much LDL you can decrease by using natural methods. And when you look at the graphs, you see that natural methods can often be as effective or even more effective than using the most commonly prescribed statins in America. So after seeing this evidence, you should all have your idea of what is the best choice. You now understand why statins are prescribed so openly. You understand what the dangers and benefits of statins are, and you understand the reality that you can lower your cholesterol without using the drug. Now, you have to spread the word and tell your parents, your friends, your acquaintances, and save them from getting into the trap of statins. Help yourself and everyone around you make smarter decisions about how to control your cholesterol.